subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Senior today. We are delighted to have here with us yet again Dr. Prasanna Shah. Let me introduce Dr. Shah first. Dr. Shah is a leading consultant interventional gastroenterologist and is attached to the Beach Candy, Jaslok and Saifee Hospitals in Mumbai. He has vast experience in therapeutic endoscopy and corrective endoscopy for weight loss. In the recent issue of November 25th, 2025, Dr. Shah, and he has written several articles for us in the past, has written an article on Crohn's and inflammatory bowel disease. He wrote on Crohn's disease, and I'm going to ask our producer to just show a screenshot of the article, so all of you should take a look at it. The article is here. So this is Navigating Crohn's Disease. This is in the November 2024 issue of the magazine. You can go through that. The magazine is available on seniorstoday.in and it's available free of cost. So please do look at it. But we have taken this opportunity to speak to Dr. Shah about and requested him to speak about Crohn's as well as inflammatory bowel syndrome or disease, whatever it's called. And welcome to Health Live, Dr. Shah. How are you?
Thank you, Pradhiman. Once again, I thank Seniors today for giving me this opportunity to share my thoughts on a rather complex and a debilitating condition called inflammatory bowel syndrome, or disease as we call it, IBD. Now, inflammatory bowel disease has two components. You have one is ulcerative colitis, and the second one you have is Crohn's disease. What I have covered in the magazine is Crohn's disease, all right? And there are subtle changes between the two. The main line of treatment would fairly remain the same, and certain dietary do's and don'ts, which also remain the same for ulcerative colitis and Crohn's disease. The difference between ulcerative colitis and Crohn's disease is that in Crohn's disease, one can get fistulas, okay, or perianal abscesses, but in ulcerative colitis, you do not get that. And therefore, the treatment is very different from both of these. Now, inflammatory bowel disease is been there for a very long time. In fact, in the early 70s and 80s, when my father was practicing, they would always say that Crohn's is never seen in India. But I think it's what the eyes did not know, the mind could not think. It was something of that sort. But it's there and it is increasing now. And now we are recognizing Crohn's as a condition in India. Inflammatory bowel disease affects both the age groups. It has a bimodal presentation. When I say bimodal, what it means, it can affect teens to adulthood. That means all the way from 15 to 25 or even up to 30. And it can affect even 60 onwards. So that's how we have a bimodal presentation of this disease. Crohn's disease in particular, let me talk about Crohn's. Yes, Crohn's has similar presentation also. There are subtle changes which one gets to see when you investigate for inflammatory bowel disease. Like, what are the investigations? One is you do plain blood investigations, you do CBC, you do ESR, you do what you call C-reactive protein. Then there are other tests called ASCA, anti-Saccharomyces cerevisiae antibodies, but it is not very sensitive or specific. One can do stool tests, stool fecal calprotectin, very important. One can do that. You look for occult blood, look at routine microscopy. Other things you can do is you look for, you ask them to get a CT scan done. So first we start with non-invasive, and so we do a CT scan. Why do we do a CT scan? Is because Crohn's disease, again, let me tell you, as compared to ulcerative colitis, can present as a stricture or a narrowing, which you see, we do not generally see. All right. So therefore, a CT scan of the abdomen, pelvis, and if necessary, of the small intestines. Why the small intestines? Again, in Crohn's, small intestine is affected as compared to the small and large intestine, as compared to only the large intestine, which we see in ulcerative colitis. And so therefore, a CT scan of the small intestine and the large intestine, and MRI to get more information as to the extent of inflammation, the degree of inflammation, characterizing your strictures better, the MRI is better. Well, the other test which one can do is also a capsule endoscopy, but you have to make sure that there is no stricture, and so therefore you can do what you call as a small bowel capsule. It's a small little pill one swallows. It has a battery, camera, light, transmitter, and it takes real-time images of your small intestine. And what do we get to see in the small intestine? One is we'll get to see ulcerations. And what kind of ulcerations? You'll get to see small ulcerations with normal intervening mucosa. The reason I'm saying this is because in ulcerative colitis, the mucosa is affected throughout. There is no normal mucosa between the ulcers. The ulcerations is extensive in ulcerative colitis, and there is no normal intervening mucosa. There is friable mucosa in ulcerative colitis. In Crohn's disease, you'll get to see aphthous ulcers of varying sizes with normal intervening mucosa. It could be in the colon, it could be in the small intestine. And so this is what we get to see in capsule endoscopy. It's a more non-invasive test. But if you really want to clinch the diagnosis, one has to undergo a colonoscopy or a small bowel enteroscopy. Ideally, a colonoscopy, and we go into the small part of the intestine, the ileum, and if we see ulcerations there, we take multiple biopsies from there, and we'll get to see classical features of Crohn's disease on the biopsy, and that's one how one can get a diagnosis. Apart from the small intestine, one can also see ulcers in the large intestine. Generally, in Crohn's, the rectum is not affected and the rest of the colon is affected. In ulcerative colitis, the rectum is affected all the way upwards. So these are subtle differences one has to know between Crohn's and ulcerative colitis. Crohn's disease, people thought it was uncommon, but now, mind you, it is common. 20 years of my practice, I have been seeing Crohn's more increasingly as the days are going by and as the years are going back. I would say in the last 5 years, I've seen a significant increase in Crohn's disease or inflammatory bowel disease as compared to what I had seen when I started my practice in the early 2000s. And so once you have this disease, mind you, it is a long-term disease. One need not get depressed or upset by it, because that's commonly what the reaction would be of a person if they know they have a debilitating disease or a serious condition like IBD. Unfortunately, on our Google, or what we call Google Baba, they all have too much information, and therefore inflammatory bowel disease can lead to death. But that's in very, very small percentage of patients. And so therefore people really get psyched when they read this and say, oh my God, doc, I'm going to die, and so on and so forth. So I would urge you that you do not need to read Google or whatever WebMD. Please do not do that. Your doctor is the best guide. Your dietitian and nutritionists are the best guide. Why I'm saying this is because when we come to the treatment of Crohn's disease, there are certain medications one has to take. You have the 5-ASA group, you have steroids, you have the immunosuppressive drugs, and you have good nutrition. You have to take nutrition also. You also have biologics or biosimilars, as they are called. So those are the, that's when you go into details, then one can discuss them. But the standard treatment would be starting you on ASA compounds, if necessary, a steroid, and giving you good nutrition. This is the most important thing when you're talking about Crohn's disease or Crohn's colitis. When you say the word colitis, it is inflammation of the colon, of the large intestine. When you talk enteritis, that is the small intestine. Just to tell you all, when you use the word itis, means there is inflammation. Itis is equal to inflammation. So you have appendicitis, you have tonsillitis, you have cholecystitis, pancreatitis. So whenever we doctors use itis, means it's inflammation. So just to tell you all that, colitis means colon, enteritis is the small intestine, inflammation of the small intestine. So you can have Crohn's colitis, you can have Crohn's enteritis, or you can have Crohn's enterocolitis. So this is basically a nutshell of Crohn's. Yes, in very, very severe or stricturing diseases, one has to go for surgery. But now with new molecules which are available, the new biologics or the biosimilars, we have infliximab, you have ustekinumab, you have you have many other newer ones which are which have come in. Um Stellara is there, which is ustekinumab, which is very good. You have adalimumab, and you have the infliximab. So these are 3, 4 molecules which are very good, and we have seen good remission and good healing rates using these molecules. They're a little expensive, but I think they're absolutely worth it. So important is getting your diagnosis and setting yourself on a treatment with lifestyle changes. The reason I'm saying lifestyle changes is because Crohn's disease or inflammatory bowel disease can flare if you get depressed, or if you're, I would say, uh, that if one gets anxious or is depressed, Crohn's disease or ulcerative colitis disease can flare. We have seen that. So generally, I tell patients, the more calm you are, the more happier you are, the disease will go away from your body. So just make sure that you're in a good mental space. Do not get bogged down by this disease. Do not get nervous or upset by this disease. Medical science has progressed quite a bit, and we have more answers now and more treatment options for all of you all. So if there are any questions, Pradyuman,
Yes.
this was a little snippet about Crohn's and ulcerative colitis. So go ahead.
Yeah, of course. We normally do presentations, but of course, doctor's article is there in the issue of Seniors Today. As I mentioned earlier, it is for the benefit of those who've come in late. Dr. Prasanna Shah has written an article on Crohn's disease in the latest issue, the November 15th issue of Seniors Today, which is there on the Seniors Today website. So you can look at it. We have a few questions that have come in. Doctor, one is from Mr. P. Satyanarayan. And there's a couple of other questions which are there on the similar lines. What could be the cause of irregular bowel movement, irrespective of its characteristics, whether loose, semi-loose, or hard?
So bowel movements generally, now if you're going to talk about Crohn's colitis in particular, the bowel movements can be irregular because of the inflammation of the colon. All right. It can be semi-solid to loose. You can have loose motions in this. They can be large, voluminous. They can be around 5 to 10. They can be tenesmus. That is, pain around the perianal area. You can have painful defecation. It is associated with mucus and blood. But if you really want to know about the bowel movements, then you're talking about irritable bowel syndrome. That is something completely different from IBD. In IBS, you have pain, you have constipation, you have loose motions, and you have all the 3. That is a 4th type, which encompasses all the 3 which I just said. So that is the thing. There are many causes for irregular bowel movements. The first is our own self, that we delay going to the washroom because we're outside. There's no proper stools, there are no proper washrooms, and so therefore we delay our going to the washroom on time, and therefore this lag effect goes on, and it slows the intestines, or it makes it irregular, and that's how one can develop irritable bowel syndrome. That's IBS. But today we're talking only about IBD. So I would stick to only Crohn's colitis and not others. Pradyuman, I saw one question whether it is hereditary. We have seen increased incidence of patients with Crohn's or ulcerative colitis, or if their family members have IBD. So there is nothing foolproof to tell you that it is there, but yes, it can be closely linked to it being hereditary.
Right. We have another question from Mr. Anil Singh, who asks, how can I maintain muscle strength and mobility? What exercises or physical therapy can help alleviate symptoms? In reference to IBD and Crohn's, I'm not very sure what he's specifically looking at.
Okay. So basically, how can you strengthen is you take good proteins. I think nutrition is very important. All right. As we age, nutrition goes down, protein goes down. So plant-based proteins are also good. Animal proteins are also good. Plant-based proteins, there are multiple products which are now available and they're very good. So that is one. You can take good proteins. There's something called as biofeedback. In case if there is constipation problem, one can do is biofeedback. They're basically physiotherapy for the perineal muscles, and that can increase the strength. The other thing is one can do is, which is available in the market, is called squatty potty. So it's basically, you're sitting on the on an in an English toilet, but there is a stool where you put your legs up because you need to get that angle of his. There is a certain angle in which the rectum has to be, so you can evacuate better. So these squatty potties are available. You can go and you can get them. It will definitely alleviate you of your constipation. Two, have plenty of fiber, have plenty of liquids. This is also important. Um, Sometimes stress, that can also kind of clog you up. Avoid that. Certain drugs which can clog you up, avoid those drugs. Like calcium can cause you this thing. If you take something for anti-diarrheal agents, they can also clog you up. Antispasmodic sometimes can clog you up. All right. So you have to be careful of the drugs also what you're taking, which can cause constipation.
Right, doctor. There's a question which has come in. Would you recommend having isabgol for improving the bowel movement?
Yeah, I do recommend isabgol. It's a wonderful thing to have. It's natural husk. It reduces, one is the inflammation of the colon, and two, it also bulks the stool. So your stools will be soft and pasty, and you'll have a good bowel movement. So isabgol 1 to 2 teaspoons at night in a glass of milk, which is good. If you have inflammatory bowel disease, then in water. But if you don't have that, then you can have it with milk also, or you can put it on curds. You can have it with chash, lassi. There is no problem.
All right. So, is the question about how can I manage fatigue and sleep disturbances associated with irregular bowel disease?
I think that's got more to do with mental stress and mental health. Nothing more. You need to sleep well. So if you have to sleep well, you have to eat on time. You have to have adequate liquids, fruits, juices. You have to make sure that your screen time at night is very less. Unfortunately, a lot of people are on their phones till 1:32. They're seeing Instagram posts or they are just watching videos on YouTube. I think that is should be completely discouraged. Take your phone off after 10:30, 11. Your phone is kept to the side. Do some reading, old traditional reading. That'll be excellent, and you'll automatically get sleep. Listen to some light music. That's also good. Uh, People sometimes advocate, you can have some room freshener or something for the night. People have done that. There's no scientific data on this. Let me tell you this, but I'm just telling you what people have experienced and have done. That's it.
Right. Thank you. We have a question from Naina Somaya who asks, "What is purpura? Is endoscopy needed in this disease?"
Purpura are basically red spots on your skin. They can also be in the internal lining of your intestines. Those are called henoxolin purpura. So that's a completely different condition. And purpuric spots on the skin, again, can be because of low platelets or because of some trauma. Or you can have purpuric spots uh, looking like purpuric spots if there are mosquito bites. But whenever you use the word purpura, is very classic of small thin blood spots because of low platelets.
Right. Doctor, there's a question from Rashmi Verma about mucus in stool. Is it due to IBS? Is it due to IBD?
So mucus in stool is classically more because of IBD, but you can develop mucus in the stools also in irritable bowel syndrome. But if there is mucus and blood, it's very much pathognomic for IBD. So you look at you know uh, IBD conditions when you're talking about mucus.
Right. There's a question from Shobha who says, Doctor, sometimes I feel bloating and constipated. I'm taking Trifla tab daily. Should I take or not?
Well, I really don't know about Ayurvedic medicine, so I'm really sorry. I don't think I'll be able to give a good answer. But there are good number of good pharmacotherapy agents which are available for good evacuation. You have prochloropride, you have pleclitide. There are newer molecules, lubiprostone. These are all new molecules which have come for constipation. You have bulking agents, you have laxatives. There are a host of them. Uh, if you're asking me whether Trifla works or not, I'm sorry, I don't think I'll be able to give you the right answer because I really don't know the pharmacodynamics of that drug or of the Ayurvedic medicine. So that's about it all.
Doctor, there's another natural Ayurvedic medicine concerned question, but which I'm asking. Doctor, my wife believes that Pudin Hara is a tablet that helps her digestive system. Is it scientifically all right, or a question mark?
So Pudin Hara basically a lot of people take for reflux and for gas. So I think it just works on that. So once you feel that your gas is gone, your bloating is gone, there's a sense of well-being. So I guess that's how it works. But exact working, I won't be able to comment. I'm sorry.
The same person has also asked a question and sent by SMS. Is Doctor, whenever there is some loose motions because of something that I've had incorrectly, I used to take Imodium, which causes a lot of constipation. What is the best thing to do if you have a diarrheal infection? And is Enterogermina vial a good option to take?
So do not take Imodium when you have diarrhea because we don't know what is the cause. Is it a viral diarrhea? Is it a bacterial diarrhea? Okay, viral diarrheas are self-limiting. Bacterial diarrheas, you need to treat them. You cannot stop it because the body is actually excreting all the toxins. So, and if you block it and if you reduce the flow of your stools by taking an antidiarrheal, all the toxins are going to be into the body, and that's going to get you more sick. So, we do not advocate antidiarrheals, especially so frequently, unless and until if you've proven that it is irritable bowel syndrome diarrhea. Okay, that's a completely different setting. In IBD, we do not give this. Enterogermina, yes, it's very good. It's a probiotic, but there are better probiotics than Enterogermin and stronger probiotics. So one can take those probiotics once or twice a day, depending on how much is the diarrhea.
But is otherwise probiotic, for instance, there are things like Yakult that are available, or just curds with which are branded probiotics. Is that something that you would recommend that people should have just as a normal course, especially senior citizens?
I think these days everybody talks about good bug. So that's a very big thing which has come in and it's available for many. Uh, good bug it is good, definitely. I've been part of that journey for a little while and I've given my inputs regarding the probiotics and certain products they have. So that's how I would say that good bug is good. Yakult also is on a similar line, which is also easily available. But if you want natural, and the best is like curds, which is very good. Just natural dahi, which we all have every day, like one glass of chash morning and evening. But a lot of people have allergies to curds, and they say that we get a sore throat and cold. So I think you can take any good probiotic which is available in the market.
Right. Doctor, just before the session started, we were talking about GERD and this being observed as a GERD week. There's a question which is, of course, out of the syllabus, as one says, from Vijay Ganduri, who says, Doctor, is GERD curable completely? I see people still complaining even after laparoscopic surgery.
Oh, now that's a real tough one. Those are those people, that 1 to 2% that in spite you do whatever, they are still going to have the reflux. So I think you should be aware of what are the environmental triggers for GERD. avoid cola drinks, eat early, eat small portions, avoid refluxes. Now, what are the common refluxes? You'll be surprised, Pradyuman, when I tell you the common refluxes are onion, garlic, mint, cheese, chocolate, and coffee, black coffee. And this is something we all consume every day in nice quantities without even realizing it. And we start blaming, oh, I think I had that bhel puri, or I had that pizza, or I had the pasta. It was not a wheat based pasta, doc, it was maida. And so I had this. But after you finish, what you have, commonly people have is this lovely chocolate, which I used to have when I was a kid, called After Eight. It's got chocolate and mint. It's disastrous. I mean, chocolate and mint are refluxes. So I would advise, strongly advise, no chocolates in the night. If you really want to indulge in chocolates, have it in the afternoon, does not matter. But do not have onion, garlic in raw form. Cooked form, onions are okay. Garlic is an absolute no. A lot of people use garlic these days. And so therefore they get a lot of reflux. So what I'm trying to say is make sure that the environmental factors are taken care of. Reduce your stress. All right. Exercise daily. Those are important. In spite of having your fundoplication, and if you're still having GERD, I'm sure you must have done what you call esophageal manometry. Get an esophageal manometry done, or repeat an upper GI endoscopy to see what's the status of your lower esophageal sphincter, whether it's tight, laxed. Because ideally after a surgery, the sphincter should be nice and tight and firm. But if you're still having it, then you should again have a relook. So I would suggest get a second look endoscopy, and if necessary, consult a gastroenterologist or go ahead and do a manometry. That also would be useful.
Right. Doctor, there's another question which has come in from Rashmi Verma, who says, is there a frequent urge to evacuate after eating food? What should one do?
So that's called gastrocolic reflex. It's a normal thing. There's nothing really much. But if it's really troublesome, you can take some medicine called ramisetron. You can take it once a day, or you just put yourself on good this thing. Just put yourself on a good probiotic twice a day, and the frequency should settle down. See if you're taking some foods which can produce diarrhea. If you have sweet, sugary, syrupy things, you develop what you call osmotic diarrhea, and so therefore you'll pass stools like this. So just make sure that you're having. So what are the anti-diarrheal foods? So commonly we say you should have is apple and toast. So they are the two things which can actually bind your stools. So that's good.
Apple and toast it is. Thank you, doctor, very much for all these things. But tell me, you mentioned about onion, garlic, onion not to have in a raw form, garlic not to have at all, or only the raw form?
Raw form uncooked, it's a very bad reflux.
So, doctor, what does one have?
There's so much more. Oh my God, there's so much more to have. You know that? There's so much more. See, every body, every metabolism is different. All right. And so therefore, there are various things which are available. You can get. These days, the tastes and the taste buds of everybody has changed. I'm sure when you grew up, there were just 2 or 3 cuisines which we really knew of, and now we are talking about Vietnamese food, and we are talking about Mongolian cuisine, and we are talking about some Swiss cuisine. So the taste has changed so much, but there is a lot. Just by missing out on onion and garlic, your this thing is not going to change. Don't worry about that.
Tell me something. I'm going to just leave, ask a final question to you. What does, you have a very busy life as a doctor, and you, of course, are, would be having a busy social life as well. What do you do to ensure a good, clean, healthy gut? And I'm sure you also have attractions of various types of food around. All the things that you said shouldn't be had. I'm sure, there are pulls and pressures for you to have as well. What do you do? How do you keep how do you ensure that you are IBD proof, GERD proof, all of that?
All right. So GERD proof is difficult because sometimes eating late is a thing. You got to somebody's house for dinner. I I technically, I finished my dinner by 7:15, 7:30. I'm done with my dinner. I do not do evening snacking. So my day starts off, I'm at work by 8:15. I have a cup of tea in the morning with one fruit, and I leave my house. And then in the hospital, I'll have a light little snack. I have my lunch at between 1 and 2. Then I have a cup of tea. No snacking, just a cup of tea at 4 o'clock. So by 7 o'clock, I'm really hungry. And by 7:15, I have my dinner and I'm done with it. You'll be happy to know I do not drink and I do not smoke. So I don't indulge into many things. So that is out. I don't do tobacco. I don't even chew pan or supari, nothing. So I've cleaned part of my gut that way. Important is you have one bowl of curds every day or lassi every day. It's a good natural probiotic. Whatever you eat outside, just make sure it is hot and warm and not raw, like salads, and you have street food like chaats and all. It's anything cold harbors bacteria. So one should avoid having this. But obviously, people are going to eat, people are going to get that. So you have a good probiotic. You can take any probiotic which are available in the market. The probiotics which are more than 10 billion in spores are the most effective ones. So you should read the strength. It should be more than 10 is to 10 billion. That means it's a very good probiotic. So you can do that. Important is you should get adequate rest, sleep properly. So one thing is you should be off to bed by around 11 to 12, maximum. And so you get good 6 to 7 hours of sleep. 7 hours is very good. 6 hours is also fair. 5 hours is less. Let me tell you, 5 hours is definitely less. So 6 to 7, because once your sleep is regulated, your immune system is also regulated by that. And so therefore that has a good effect. So good rest, good immune system.
Thank you very much. Doctor, there are a couple of questions that have come in. One is, can I take paneer? This is a question which is asked by Dr. Suresh Agarwal. Can I take paneer?
Yes, of course you can take paneer. Paneer is a good form of protein. There is no problem in taking proteins, and paneer is very good. We in fact advocate chena protein. We usually tell them to take that, and especially patients who are non-diabetic, I will always tell them you should take 2 rasgullas in the morning. It's the best form of chena protein one can get. It gets you going. It's a comfort food. It's a joyous food. It lifts your spirit, and you feel really happy having something sweet. So you just squeeze the whole rasgulla, and you can have 2 of them every day in the morning. It'll be very good.
Rasgullas is
if you're non-diabetic,
if you're
not in diabetics.
Doctor, there's another question which is coming. There are various forms of milk and curds that are available. Since you mentioned about curds, should one have milk? Should one have curds made of A2 milk or regular, milk, dairy milk that is available in the market is fine?
I think regular milk is good enough. You don't need these fancy milk bottles and all that. Our regular cow or buffalo milk is just good enough. You can just have any milk; it's okay. But obviously, people know that you can be allergic to certain kind of milk, so you avoid taking that. You can substitute the milk with soya milk or almond milk, but obviously you can't make curds out of it. But if you really want, curds is good. I saw a question, milk is better or curds? The curds is better in probiotics. The milk is better in proteins. It gives you the animal protein. So both are good.
And what about fruits? Orange, sweet lemon, mosambi, whatever. Is that
fruits are good? Fruits are good. There's no problem. Yeah.
Great, doctor. It's always very good to have you here. I'm on a short holiday to Goa, and I'm trying to figure, after you said all of these things, and I'm having all of that, and I'm going to keep that in the back of my mind as to what I'm going to eat tonight and and tomorrow. But be that as it may, thank you very much, Dr. Prasanna Shah, for being here. It's always a pleasure having you there for our Health Live sessions, as well as writing in our magazine. We will be back again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. This session that we've had today, The edited video will be there on the Seniors Today website on Monday at 5 p.m. and as well as the takeaways, which are written by a medical practitioner. So that will also be up on this website. So you can go through that as always, and of course go through some of the past articles and webinars that Dr. Prasanna Shah has taken with us. All of that is there on the Seniors Today website. Thank you once again, Dr. Shah, for being here and for being there for Seniors Today. Thank you.
Thank you, Pradhiman. Always a pleasure. Thank you so much. Have a good weekend. Thank you. Bye-bye.
Bye.
Subscribe now and press the bell icon. Never miss an update.